Hello, everyone. Welcome back to another day of our review session. We are on day 70 out of the 90 days free session. So if you're new to the channel, you're welcome to stay with us for the duration of the session. And for those who are the regular attendees of our review sessions, you're welcome as well. And you are invited to join and enroll to our NCLEX course via www.stancoast-nclexcoaching.com. We are offering our comprehensive NCLEX review there, and this is accessible for about 6 months with your subscription. And we have about 3,000 NCLEX questions and also 200 NGN test questions, plus the 200 hours of on-demand videos and 20 hours of animated video series as well. So kindly check out on that description link. And also, if you haven't subscribed yet to the channel, please do that. And if you find this video helpful, please click that like button for us so you can also help us out. Now, don't forget to share this video to your friends who are also preparing for the examination. Now, let's get started to our first question of the day regarding hypothyroidism and hyperthyroidism. Item number 1 states, while evaluating a new client at the clinic, a nurse observes the client has dry, flaky skin, thin hair, and thick, brittle nails. What should the nurse do first? Is A, explain the role of nutrition in maintaining healthy skin. B, suggest the patient see a podiatrist for nail care. C, discuss the need for additional tests with the healthcare provider. And D, advise using creams and lotions to hydrate the skin. Take your pick. All right. If you had answered letter A, explain the role of nutrition in maintaining healthy skin, this is an incorrect option. We know that nutrition is really important for skin health, right? But the immediate concern in this test question is to investigate those systemic causes of the symptoms that we are actually having here. And so if there is such malnutrition, such as in the case of an endocrine issue, then we are going to investigate further to find out if the patient has hypothyroidism. If you'd answered letter B, suggest the patient see a podiatrist for nail care. Well, that is also a good suggestion, but to really investigate what is causing this, the following manifestations, then letter B would not really offer that resolution to the problem. It is not the priority action this time. If you had answered the letter C, which is to discuss the need for additional tests with a healthcare provider, this is going to further investigate if they have hypothyroidism or malnutrition. So we will have definitive answers to the patient's problem. Okay, so these are the manifestations, possible manifestations of hypothyroidism. If you had answered letter D, advise using creams and lotions to hydrate the skin, you're only advising the patient to treat the dry skin, but it's not really figuring out what is causing the manifestation. So it doesn't resolve, it will not identify the underlying cause. So our correct answer here is letter C. So definitely you need to investigate further, guys, especially that this is something that could potentially affect other organs in the body. These are just superficial manifestations: dry, flaky skin, thin hair, and thick, brittle nails. Only integumentary manifestations. But we need to know if there are other key signs or manifestations that may be associated with these. Now let's have number 2. To determine whether a patient's hypothyroidism is due to an issue with the anterior pituitary gland or the thyroid gland, which lab test should the nurse check? Is it A, thyroxine level, B, triiodothyronine or T3 level, or C, thyroid stimulating hormone or TSH, or D, thyrotropin releasing hormone level? So we need to identify or figure out whether the hypothyroidism is possibly caused by the issue within the anterior pituitary gland, or is it the thyroid gland itself? If you'd answered letter A, thyroxine or T4 level, what do you think about that? Well, this is not really going to help in differentiating between the primary or the secondary type of hypothyroidism causes. It will not. Okay. What you're going to have instead is letter C, which is the thyroid stimulating hormone level. That is the TSH. This is what we're looking for. Why? It is because when there is a reduced TSH level, this simply means that the issue is basically with the anterior pituitary gland. Okay, APG or anterior pituitary gland. While an elevated TSH level, this is going to suggest that the primary issue is within the thyroid gland. So please take note between the elevation or decrease of the TSH. Take note, guys, our thyroid stimulating hormone is that hormone that is released by the APG to cause the thyroid gland to produce the T3 and T4. However, if there is a problem in the anterior pituitary gland, then this will not be able to stimulate the thyroid gland. If there's a problem with the APG, it will not be able to really stimulate the thyroid gland to produce those two hormones. So that's going to be a reduced TSH. However, if it is increased, then there is a problem in the thyroid gland itself. So the others will not really differentiate the issue between the anterior pituitary gland or the thyroid gland. So the definitive answer here, it is letter C. Let's have number 3. A patient's lab results show a free T4 level of 0.6 nanogram per DL and a free T3 level of 18 picograms per deciliter. How should the nurse explain these findings to the patient? Is it A, these results suggest you might have Graves' disease, or B, you may have signs of hyperthyroidism, or C, we need additional total T3 and T4 tests to confirm, or D, checking your TSH level will help clarify the diagnosis? So we're talking about the values here, T4 and T3. But your task here is to select that statement that the nurse should tell the patient about the two values. If you had answered letter A this time, these results suggest you might have Graves' disease. Is that correct? Do you think that these values are actually signifying that the patient has hyperthyroidism? So let's identify first the value of free T4, 0.6 nanograms per deciliter. The value for this free T4 supposedly should be at 0.9 to 1.7 nanograms per deciliter. Okay, that should be our reference range. This is the normal value, 0.9 to 1.7. So our patient's free T4 is way below, okay? And if you're going to look into the T3, the free T3 level of 18 picograms per deciliter, that is supposed to be around, let me just write this down here, that should be around 20 to 44 picograms per liter. So our deciliter rather. So our patient's value is still below the acceptable range. Now, if you had answered letter A, these results suggest you might have Graves' disease. We are eliminating this option because the patient's free T4 and T3 values do not represent the hyperthyroidism. We know that Graves' disease is characterized by the elevation of both T3 and T4. So this is an incorrect option. Graves' disease, there should be elevation in T3, T4. However, our patient's values are way below the acceptable ranges. Now, if you'd answer letter B, you may have signs of hyperthyroidism. Nope. Still incorrect. The values alone are reflecting that the patient has hypothyroidism. If you had answered letter C, we need additional total T3 and T4 tests to confirm. Well, the patient's values are actually, the T3 and T4 will not offer more diagnostic value to support the free T4 and T3. They are already low. So if you had selected letter D, check your TSH level. Checking your TSH level will help clarify the diagnosis. This is the correct answer that we are looking for. This is going to help the medical provider to distinguish between the primary and also the secondary hypothyroidism. We know that the pituitary gland will respond to the thyroid hormone levels. So again, the values here are reflecting hypothyroidism states. But again, we need to have that definitive testing, which is letter D. Let's have number 4 this time. During a teaching session, which statement by a patient taking levothyroxine indicates that they need more education? Is it A, I will consult my provider before taking heartburn medication, or B, I should notify my provider if I experience sleeplessness, shaking, or rapid heartbeat, or C, if I take a multivitamin with iron, it should be 4 hours after my synthroid dose, and D, I might need to lower my synthroid dose if I take calcium supplements. So your task here is to identify that statement from the patient that indicates they need more education. Simply asking you to identify that patient statement that needs correction. All right, let's go ahead with the rationales. If you had answered letter A, I will consult my provider before taking the heartburn medication. This statement signified that they understood the precautions they should take. So we know that the medication involved here, heartburn medication, it could be antacids, right? And antacids will contain calcium. And we know that calcium can interfere with the levothyroxine absorption. So having this statement is actually, it signifies understanding. So we are not selecting that one. If you'd answered letter B, I should notify my provider if I experience sleeplessness, shaking, or rapid heartbeat. These manifestations reflect that they might have levothyroxine overdose. So if the patient states, I should notify my provider if I experience these manifestations, that reflects understanding to report those manifestations to the medical provider. If you'd answered letter C, if I take a multivitamin with iron, it should be 4 hours after my synthroid dose. That also reflects understanding. We know that iron can interfere with levothyroxine absorption. So if they stated that it should be 4 hours apart, yes, that reflects understanding. So take note, guys, iron interferes the absorption of levothyroxine. This should be taken at least 4 hours after they take the Synthroid. And if you have done this, if you had administered the Synthroid to your medical patients, it is supposed to be taken early in the morning before breakfast. Okay, it should not be taken with any food at all. No calcium supplements, no iron supplements, because these can interfere with the drug's absorption. So our correct answer this time would be letter D. I might need to lower my Synthroid dose if I take calcium supplements. It does not reflect understanding. So you should be correcting this statement. We know that they should not be taking the Synthroid together with the calcium. Again, they should be taken 4 hours apart. Okay? To avoid absorption interference. Right. So, very good. You got all this question correct. Let's proceed to number 5. A patient with severe hypothyroidism exhibiting a heart rate of 60 beats per minute and a temperature of 97.2 is lethargic and hard to wake. Which medication should the nurse request from the provider? Is it A, beta blocker, B, higher dose of oral levothyroxine, C, intravenous levothyroxine, or D, methimazole, known as Tapazole? Your patient has severe hypothyroidism. Their heart rate is borderline 60 beats per minute. They are lethargic and hard to wake. So which medication you should request from the medical provider? If you had answered letter A, beta blocker, we know that beta blockers are really important in the treatment of other disorders. Could be used for hypertension, tachycardia. But our patient here has hypothyroidism. Most of them, they will manifest low heart rates. 60 beats per minute doesn't really need a beta blocker, right? They will end up with a severe bradycardia if they're going to end up when they're going to take a beta blocker at this time, so it will be unsafe for them to have that one. If you answered letter B, higher dose of oral levothyroxine, your patient is lethargic, hard to wake. You think this is a safe intervention? Higher dose of oral levothyroxine? I guess not. We know that the oral levothyroxine has a delayed onset, and it would not be suitable for this patient that has a myxedema coma, right? Nope. It will not be the treatment of choice this time. So what would you do here instead? You are going to have to request for an intravenous levothyroxine. This will give a rapid treatment for this patient's myxedema coma, which is life-threatening state of hypothyroidism. So you need to prioritize your nursing action by dealing this life-threatening condition. The correct answer here is letter C. If you'd answered letter D, methimazole, what is that? Methimazole is an anti-thyroid medication. This is indicated for hyperthyroidism, not hypo. Yeah, that's correct, Mary. You should not be giving any oral meds this time because of the patient's decreased level of consciousness. Unsafe to administer oral meds. And your goal here is to actually treat this patient's myxedema coma rapidly. We need to make sure that they're not going to go downhill fast. So we're going to have to reverse that. Again, methimazole is not indicated for hypothyroidism. This is an anti-thyroid drug. So if you're going to give this medication to this patient, the more that they're going to have hypothyroidism. We don't want that. Number 6. A patient recovering from myxedema coma is set for discharge in 2 days. Which teaching strategy will best help the patient manage their condition at home? Is A, postpone teaching until discharge day, or B, provide written reminders of the information given, or C, offer several options for therapy management, or D, teach in private by asking the family to leave? The patient recovering from myxedema coma is supposed to be discharged in 2 days. So which strategy you should use for this patient in order that they can manage their condition at home? Will you do A or B, C or D? If you'd answered letter A this time, postpone teaching until discharge day, will that be appropriate? When you are delaying the teaching, it will also reduce the patient's ability to absorb and understand those important information necessary. Should not be done during the discharge day. The education can start as early as possible before they are discharged. So this can reduce education time, and comprehension will be more complex around this time if you are going to have to cramp all those information at the day of discharge. That's going to be way too much for them to absorb. So this is not an effective strategy in educating the patient. Again, you can start the education as early as you can before the day of discharge. And all throughout those days, if they did not really understand, you got to have to reinforce those teaching. Make sure that they are asked what they understood about the education. Clarify those questions. If they had misunderstanding, make sure that you're going to correct them as well. If you had answered letter C, which is offer several options for therapy management. Options for therapy management. Does that really gonna help out in managing their condition at home? Several options. What we need to do instead is to simplify the treatment regimen, which will enhance their adherence. Several options. Seems too good to be true. But what you got to do instead is to simplify treatment. Okay, so they will be able to comply to the regimen. The more that they have several options, the more that they're going to get confused. So eliminating letter C, we had letter D. Teach in private by asking the family to leave. Why would you instruct the family to leave? The better option here is to basically to have the family or the caregivers get involved. So this can also reinforce the teaching. So they will have better support at home. not a good action. You should involve the family. Of course, with the patient's permission, right? We are going to eliminate letter D. If you had answered letter B, provide written reminders of the information given. Yes, those reminders, those instructions will support the memory and also their understanding, especially that the hypothyroidism patient can have issues with cognitive function. So make sure that you're going to incorporate those simple written reminders. So the correct answer is letter B. Provide written reminders of the information given. We're talking about a patient that has hypothyroidism, even myxedema coma. They have cognitive function issues. And frequent reminders or simple reminders will assist that education. Number 7, before administering levothyroxine to a patient with hypothyroidism, to a patient with hypothyroidism and hypertension, which finding should prompt the nurse to contact the healthcare provider? Is it A, elevated thyroxine level, or B, blood pressure of 110/64, or C, heart sounds that are faint and hard to detect, or D, increasing thyroid stimulating hormone level? Before administering levothyroxine to a patient, which finding should prompt the nurse to contact the healthcare provider? Is it A, elevated thyroxine level, or B, blood pressure of 110/64, or the heart rate or heart sounds that are faint and hard to detect? Or is it letter D? If you had answered letter D this time, increased thyroid stimulating hormone. Increased thyroid stimulating hormone. This is incorrect. We know that elevated TSH indicates that more thyroid hormone replacement may be necessary. Take note about that. Increase in the TSH, actually, it is an indication that the patient is still in a hypothyroid state. So it simply means that the medication is still not therapeutic this time. If you'd answered letter C, heart sounds that are faint and hard to detect, this is a common manifestation in hypothyroidism, and this is not going to contraindicate the administration of levothyroxine. Take note about the question. Which finding should prompt the nurse to contact the healthcare provider? Heart sounds that are faint, this is expected in hypothyroid state. Nothing to be too concerned about that. What about letter B? Blood pressure of 110/64. Looks normal to me. It doesn't contraindicate the use of levothyroxine administration. Doesn't look too bad. Not gonna call for a immediate notification. There's nothing else but letter A, elevated thyroxine level. What is that? It simply means that the patient probably is getting way too much of the dose here. So this is signifying over treatment. So this will require adjustment of the dose. Again, letter A is way too much level of that levothyroxine. It simply means that they are probably overdosing. They are getting way too much synthroid. This will call for adjustment of the dosage. Okay? It's B. What do you mean by it's B? Okay. Let's have number 8. A patient is prescribed levothyroxine and also takes warfarin. What should the nurse discuss with a healthcare provider regarding the patient's medication regimen? Is it A, decreasing the levothyroxine dose, or B, decreasing the warfarin dose, C, increasing levothyroxine dose, or D, increasing the warfarin dose. Your patient is taking Synthroid, but they're also taking the Coumadin. So which of the following options here you should discuss with a physician regarding their medication regimen? Would that be A, B, C, or D? If you pick letter A, decreasing the levothyroxine dose, this is incorrect because we know that the Synthroid can affect the metabolism of the vitamin K-independent clotting factors. So what we are going to do here instead is to talk with a medical provider in changing the dose for the warfarin, which is to decrease the warfarin dose. Why? The levothyroxine can have an effect onto the warfarin. It will cause the degradation of the vitamin K dependent clotting factors. So this medication, the levothyroxine, can enhance the effect of the warfarin. It will cause the patient to bleed some more. It will cause some more blood thinning effects. So we should talk with a physician about decreasing the warfarin dose this time, as we know this can enhance the anticoagulant effect. Enhances anticoagulation. So this should be our answer this time. Okay, we are not going to decrease the Synthroid dose. The patient would need that to treat their hypothyroidism. You don't want to increase the levothyroxine dose because this will cause more enhancement of the warfarin's anticoagulant effect. If you're going to do letter D, increasing the warfarin dose, all the more that the patient will bleed out. And not letter A as well, decreasing the levothyroxine, you're supposed to treat the patient's hypothyroidism. All right, let's have number 9. An elderly patient with hypothyroidism has lab results showing a free T4 level of 0.5 nanograms per DL and a TSH level of 8 microunits per ml. TSH, 8 microunits per ml. The doctor prescribes 100 micrograms per day of Synthroid orally or levothyroxine. What should the nurse do next? Would that be A, follow the order and give the medication? B, call the doctor to discuss IV administration of levothyroxine? Or is it C, suggest switching to desiccated thyroid Armour or Armour thyroid? Or is it D, recommend a lower starting dose? We're talking about a patient that is elderly, that has hypothyroidism, and they have those lab values. T4, free T4 of 0.5, TSH level of 8 microunits per ml. Now let's identify the values here. T4, that is 0.5, that is below the acceptable range. We know that free T4, T4 should be somewhere between 0.9 to 1.7 nanograms per DL. That should be the acceptable range. If you're going to look for the TSH value, normal range, it should be about 0.5 to 5. 0.5 to 5 micro international units per liter. So our patient's value, look at that, TSH, it's way above the acceptable range. There is elevation of the TSH. So that simply means there is an issue in the thyroid gland. Okay. If you'd answered letter A, what is this? Follow the order and give the medication. Will you do that? That is incorrect. If you're going to administer that 100 micrograms per day without questioning the order, this is incorrect, because older adults should generally start with lower doses in the levothyroxine to prevent those adverse effects. Okay, so this is such a huge dose. We're talking about an elderly person. They should start in smaller doses. And then it should gradually be increased according to the need, according to the patient's manifestations. We should question that order. If you'd answered letter B, call the doctor to discuss IV administration of levothyroxine, this is incorrect as well. This is not necessary unless they have severe hypothyroidism symptoms like myxedema coma, but IV levothyroxine is not indicated yet. If you answered letter C, suggest switching to desiccated thyroid, or known as the Armour thyroid. What is this? It is not recommended for new patients because they have inconsistent hormone levels, and this medication is only used for those patients that are already on this medication for quite some time, and for those who have already much more stable T3 and T4. Okay, so again, not recommended for new hypothyroidism patients. Not recommended for newly diagnosed hypothyroid patients. This is only intended for those patients that have been diagnosed for quite some time and they have been using this drug and they are quite more stable in their thyroid hormones. So we are not selecting that one. The correct answer this time is to recommend a lower starting dose. The usual starting dose for this patient, especially the elderly, is somewhere around 25 to 50 micrograms per day. And take note, we are dealing with an elderly patient. The reason why we are suggesting a lower dose, this is to prevent adverse cardiac complications. Prevents cardiac complications. That's the primary reason, especially for the elderly population. So our correct answer here is letter D. Let's have number 10. A patient comes to the ER with a rapid heart rate of 128 beats per minute and a fever of 105 degrees Fahrenheit. The patient's skin is hot and sweaty. The lab results show a free T4 level of 4 nanograms per DL, free T3 level of 685 picograms per DL, and TSH level of 0.1 micro units per ml. What treatment does the nurse anticipate? Is it A, IV levothyroxine, B, radioactive iodine, C, methimazole, D, propylthiouracil, or what we call as the PTU? Your patient is tachycardic with elevated temperature. Their skin is hot and sweaty. And look into the lab values. The free T4 is 4 nanograms per DL. And their free T3 is 685 picograms per DL. So what are those values signifying? If you'd answered letter A, IV levothyroxine, do you think this is appropriate for this patient that has those manifestations? If you're going to administer the levothyroxine, this is going to worsen their condition. They have hyperthyroidism. This is a case of hyperthyroidism. Take note that they have already tachycardia, elevated temperature, The value in their T4 is, the free T4 is so elevated, 4 nanograms. We know that the FT4 is supposed to be at 0.9 to 1.7 nanograms per DL. Whereas the FT3, they have 685 picograms per DL. It should be 20 to 44 picograms per DL. Their value is way too elevated. So what are you going to do here instead? This can worsen. Letter A can worsen the hyperthyroidism. If you'd answered letter D, the PTU, that is a correct answer, guys. The propylthiouracil is going to treat the patient's thyroid storm. And this is what the patient is experiencing at the moment. Okay? So what is the role of the PTU? What is the drug action of this medication? It is going to inhibit the synthesis of both the T4 and the T3. It will inhibit the conversion or the synthesis of the T3 and the T4. So this will really treat the patient's thyroid storm. Inhibits synthesis of T4 to T3. Okay. This will rapidly control the patient's thyroid storm. If you answered letter C, methimazole or tapazole, what is that? This is more of a treatment that is intended for long-term care, but not indicated in a case of a thyroid storm. It will not block the conversion of T4 to T3. Appropriate for long-term management, not for the acute state of thyroid storm. If you'd answered letter B, this is also incorrect, which is the radioactive iodine. Why? What is this medication? It is not appropriate in treating the patient in a thyroid storm. It has a delayed effect. Only given for patient in hyperthyroid state, but for much more long-term management, not for the acute thyroid storm. So you're going to have to select that medication that is intended for the acute hyperthyroid state, which is the thyroid storm. Let's have number 11. A registered nurse is caring for a patient with an enlarged thyroid gland and possible hyperthyroidism. Which action shows the RN may need further education? Is it A, the RN measures blood pressure in both arms? Or B, the RN feels the neck to check thyroid size? Or C, the RN orders saline drops for the patient's protruding eyes? Or D, the RN lowers the room's temperature setting? Patient has possible hyperthyroidism, has enlarged thyroid gland. So you're gonna select that option that shows that the RN will require further education. So which of these actions are incorrect? If you answered letter D, the nurse lowers the room's temperature setting. We know that the patient with a hyperthyroid state, they have what? Heat intolerance. Their metabolic rate is skyrocketing. They tend to have higher temperature. And so if the nurse lowers the room temperature setting, that's basically cooling the temperature. So this can alleviate their discomfort, especially when they have heat intolerance. So this is an action that reflects good understanding about the disease process. This is a good action. If you had answered letter C, the nurse orders saline drops for the patient's protruding eyes. It doesn't, the saline drops, this is something that you can do to help her relieve the patient's dryness, because most of the time when they have that hyperthyroid state, they will have the exophthalmos. This can cause dryness into the sclera, okay? You need to treat that, or else they're going to end up with permanent complications. So we need to alleviate the discomfort by providing them saline drops, eye drops. This reflects good understanding about the disease process as well. If you selected letter B, the RN feels the neck to check the thyroid size. Why would you do that? Your patient already has an enlarged thyroid gland. If you're going to allow this nurse, or if you're actually doing the palpation, this can trigger the release of the thyroid hormones, and this will worsen the hyperthyroid symptoms. Triggers release of thyroid hormones, adding more issues to this patient. Thyroid hormones. This is the answer that we are looking for. If you answered letter A, the RN measures blood pressure in both arms. Nothing wrong about that. This can give us a better information about their vascular health, comparing both sides to see if there's any significant variation between the two arms, of course, with the blood pressure reading. This doesn't require further education. However, letter B will. So we have answer letter B. We should not palpate that thyroid gland because, again, it can allow the escape of those thyroid hormones, which will worsen their condition. Let's have number 12. A 58-year-old patient is starting treatment with radioactive iodine for hyperthyroidism. What should the nurse teach the patient? Is it A, take radiation precautions with all bodily fluids, or B, expect relief from hyperthyroid hormones or hyperthyroid symptoms rather within a week, or C, be aware that hypothyroid symptoms might develop as the treatment progresses, or D, stop taking any anti-thyroid medications before starting the radioactive iodine. You are teaching this patient who's supposed to start their treatment with RAI for their hyperthyroidism. What would be that teaching? For letter A, take radiation precautions with all bodily fluids. This is incorrect. The dose that is prescribed for the RAI, it doesn't really require radiation precautions. The dose is low, and so you don't have to exercise radiation precautions this time. If you'd answered letter B, expect relief from the hyperthyroid symptoms within a week. We're talking about RAI. The drug effects are not instantaneous. No. The patient is expected to feel those changes or therapeutic relief in about 2 to 3 months. So there is such a delay effect, and this is expected when they are using the RAI. Okay? Within a week makes that statement incorrect. Not within a week. It will take good 2 to 3 months for them to feel that there is a change in their metabolic state. Okay, we need to give them that realistic time frame. This is way too early, so we are eliminating that one. If we answered letter C, be aware that hypothyroid symptoms might develop as the treatment progresses. Yes, that's the one that we are looking for. because the common result in the RAI therapy is the development of the hypothyroid state. So we need to keep monitoring the patient for a possible thyroid hormone. Okay. Yeah. RAI can lead to hypothyroidism. But before we can cause this complication, we need to keep monitoring. Okay. If you answered letter D, stop taking any antithyroid medications before starting RAI, is this required? No. The patient should be taking those antithyroid medications continuously, initially to control the symptoms of hyperthyroidism until the RAI begins to take effect, which is around 2 to 3 months. So they should still be taking the antithyroid medications. Okay. All right. Let's have a quick break. We are encouraging you to enroll into our NCLEX course via our website, or also you can click the link below to know more about the offering that we have. Number 13, a patient with Graves' disease is preparing for radioactive iodine therapy. Which patient statement shows they understand the treatment? Is it A, I need to stay away from my family for a week to avoid radiation exposure? Or B, this treatment will target and destroy my thyroid cells to lower my thyroid levels? Or C, this therapy will help with my cold intolerance and weight issues? D, I will need to take this medication daily for the next year. Take note that Graves' disease is hyperthyroidism. So they will be taking the radioactive iodine therapy. So which of the statements by the patient, which of the following statements pertains or reflects understanding to the therapy? Well, if you answered letter A, I need to stay away from my family for a week to avoid radiation exposure, we know that the radiation exposure is not the radiation exposure is very low, so there's no precaution needed this time. Okay, so they should not isolate from their family members. This is an incorrect statement. If you answered letter D, I will need to take this medication daily for the next year. RAI. The RAI is not a daily medication. It is a one-time treatment. But the therapeutic effect of the drug can take about 2 to 3 months. Not daily. It's a one-time treatment. If you answered letter C, the therapy will help with my cold intolerance and weight issues. The patient with the Graves' disease doesn't have cold intolerance. These statements signify that they have hypothyroidism, not hyperthyroidism. So this is incorrect. So we are left with letter B, which is this treatment will target and destroy my thyroid cells to lower my thyroid levels. That is the drug action. It will destroy those overactive thyroid cells. So this will reduce the thyroid hormone levels. So this will treat their hyperthyroid symptoms. So the correct answer here, it is letter B. Let's move on to number 14. A patient starting methimazole tapazole for Graves' disease is receiving medication education. Which statement indicates correct understanding by the patient? Is it A, I'll need frequent liver function tests due to potential liver damage? Or B, I should inform my doctor if I develop a sore throat or fever? Or C, I will require regular blood counts every few months? Or D, it's safe to become pregnant while taking this drug? Patient is taking tapazole for their hyperthyroidism. You're going to select that statement that reflects understanding. So if you'd answered letter A, I'll need frequent liver function tests due to potential liver damage. Will that cause liver damage? It does not cause liver damage toxicity. Incorrect. What can cause liver damage is the PTU, not methimazole. So for the PTU, you should be checking the patient's LFTs frequently. Okay? Not methimazole. It's not known to cause liver impairment. If you answered letter B, I should inform my doctor if I develop a sore throat or fever. Take note, guys, we're talking about a PTU. The PTU has an adverse effect we call agranulocytosis. This is a rare adverse effect, but it is life-threatening. When you are dealing this patient with agranulocytosis, they are prone to infection because their neutrophil count is severely reduced. Agranulocytosis is that significant drop in their neutrophil count. And that simply means that their value is below 500 cells per microliter. There's neutropenia. So if they are complaining about a sore throat or fever, that is already a red flag. The patient has an ongoing infection. I should inform my doctor if I develop, not ongoing, rather. So if they're saying that they should be talking to the doctor right away, if they have the fever or sore throat, this is reflecting that they understood the adverse effect of the medication, right? If you answered letter C, I will require regular blood counts every few months. Every few months will not really ensure a timely detection of the neutropenia. No. The agranulocytosis can occur suddenly, so periodic blood counts alone cannot detect that. So we are eliminating letter C. If you answered letter D, it's safe to become pregnant while taking this drug. Is that correct? Safe? No. The methimazole is contraindicated in the first trimester because of its teratogenic risks. Methimazole is possibly going to cause teratogenic effects, especially during the first trimester of pregnancy. Not safe. So we are not selecting that one. We have our option, letter B. Make sure that they are educated to report any signs of infection, sore throat, or fever. Number 15, a patient with hyperthyroidism is starting antithyroid medication and asks about dietary changes. What food should the nurse advise the patient to avoid? Is it fava beans, or B, high purine foods, C, grapefruit, or D, shellfish? Your patient has hyperthyroidism and they are taking antithyroid drugs. Your patient is asking about dietary changes that they should be doing. So what would be the best advice that you can give them? Is it avoiding fava beans, or avoiding high purine foods, or is it avoiding grapefruit, or avoiding shellfish? If you answered letter A, fava beans restriction, it's not associated with exacerbation of the hyperthyroid state, and so they can still be allowed to consume this food item. If you answered letter B, high purine foods, this is indicated. The restriction of high purine foods is indicated in patients with what? Gouty arthritis, not a patient with hyperthyroid state. If you answered letter C, restricting grapefruit, what does that mean? The grapefruit is avoided in some other medications, especially with what? The statin medication, right? But not known to cause drug interaction with the antithyroid medication. So we don't have any other option but letter D, which is shellfish. We know that shellfish is rich in the iodine, and this can exacerbate their hyperthyroid symptoms. This can increase the thyroid hormone secretion or production. So this is what we should be teaching to them. Avoid shellfish intake. All right. Number 16, a patient undergoing hypothyroidism treatment reports experiencing insomnia, nervousness, and skin flushing. Before notifying the physician, what should the nurse assess? Is it A, blood sugar levels for possible hypoglycemia, or B, heart rate for signs of tachycardia, or C, hydration status, or D, temperature for possible infection? Patient is undergoing hypothyroidism treatment, and now they are experiencing insomnia, nervousness, skin flushing. So before you make that notification to the doctor, what you should assess first. If you answer the letter A, blood sugar levels for hypoglycemia, insomnia, nervousness, are these consistent with hypoglycemia? No. These manifestations are more aligned with excessive thyroid hormones. The nervousness, skin flushing, excessive thyroid hormones, not hypoglycemia. If you answered letter B, heart rate for signs of tachycardia, yes, that's the answer that we are looking for. Aside from the nervousness, skin flushing, insomnia, the patient will also experience tachycardia, rapid heart rate because of the increasing thyroid hormones. Remember that it can increase the basal metabolic rate. That's the one that we are looking for. If you answered letter C, hydration status, we know that this is important, that we should be monitoring their level of fluid intake and also the hemodynamic status that would reflect their hydration, right? But they are not, the hydration status did not reflect directly the excess thyroid hormones. No. If you'd answered letter D, temperature for possible infection, the patient is experiencing hyperthyroid state, not infection. Okay? We don't have any other answer but letter B. Now let's have number 17. Right. We have some more questions here. A nurse is assessing a patient with hyperthyroidism who is taking PTU 100 milligrams per day divided into 3 doses. Which patient statement would indicate that the medication is working effectively? Patient is taking PTU 100 milligrams per day for their hyperthyroidism, and the dose is divided into 3 doses. Which statement would indicate that the medication is working effectively? Is it A, I feel overly energetic all day long? Or is it B, I can finally get a good night's sleep? Or C, I've been losing weight since starting this medication? Or D, I sweat a lot throughout the day? You remember that this is an anti-thyroid drug to treat the excess thyroid hormones. If you answered letter A, I feel overly energetic all day long. Overly energetic. That's a clue right there. Should that make the patient overly energetic? No. The excessive energy is a symptom of hyperthyroidism. It is not a sign that the PTU is working effectively. What the PTU should be doing is to reduce the manifestations of hyperthyroidism, because it should reduce the thyroid hormone production. So we are marking this as incorrect. If the patient stated, I can finally get a good night's sleep, so simply means that maybe they probably had some trouble sleeping before the PTU. So this is indicating that the thyroid hormone levels are now decreasing. So there is a reduction of their hyperthyroid symptoms. So this is the correct answer, which is letter B. If you'd answered letter C, I've been losing weight since starting this medication. Losing weight since starting this medication. No, that is incorrect, because weight loss is a manifestation of hyperthyroidism. The weight loss is indicative that the medication is not effective. So we are marking this incorrect. Not weight loss, guys. Letter D, I sweat a lot throughout the day. Again, that pertains to the heat intolerance. Excessive sweating, that's a sign of hyperthyroidism. So that indicates that the drug is still not working. It has not achieved yet its therapeutic goal. So this is incorrect. Let's have number 18. We're almost through here. While administering a saturated solution of potassium iodide, or SSKI, what should the nurse do to ensure safe and effective administration? Is it A, pour the solution over ice to cool it, or B, combine the solution with an antacid, or C, dilute the solution with water, milk, or juice, and use a straw for drinking? Or is it letter D, mix the solution into pureed fruits or vegetables? We're talking about SSKI. You are going to instruct the patient about the safe use of this medication. Will you do letter A, pour the solution over the ice to cool it? No, it's not an appropriate teaching. Or actually, it's not teaching, it's an action. Okay, so this action by the nurse is not going to allow proper dilution of the solution. The goal of this question is for you to identify if the nurse is able to administer this medication safely. The medication should be diluted because it can cause mucosal irritation. All right? The reason for the dilution, it's because the SSKI can cause mucosal irritation. And this is what we need to do to prevent this from happening, not just pouring the solution over ice to cool it. If you answered letter B, combine the solution with an antacid, this is also incorrect. The use of antacid is not recommended for diluting the SSKI, and it doesn't address the solution's taste as well. It is very distasteful. It also can cause mucosal irritation, so it doesn't address that effect. If you answered letter C, dilute the solution with water, milk, or juice, and use a straw for drinking. This is the best action that the nurse should be doing in order to reduce the medication's strong taste, and it will also reduce the mucosal irritation. And having the patient use a straw can also prevent teeth staining. So make sure that you offer that diluted medication with a straw, and make sure this is fully dilated to reduce the strong taste and also prevent mucosal irritation. That is the correct answer. If you had answered letter D, mix the solution into pureed fruits or vegetables, this is not going to thoroughly dilute the solution. The pureed foods can lead to direct contact with the teeth. It will cause staining, and this will not effectively disguise the unpleasant taste. So we are eliminating letter D. All right. 2 more items. Number 19. A 37-year-old patient has just arrived in the recovery room after thyroid surgery. Which of the following observations should be immediately reported to the surgeon? Is it A, the patient is difficult to wake? B, there is increasing swelling at the neck? C, the patient rates the incision pain as 7 out of 10. Or D, the patient's heart rate is 112 beats per minute. Your patient just arrived in the recovery room after a thyroid surgery. So which of the following observations by the nurse should be reported to the surgeon immediately? What would be your answer? If you answered letter A, the patient is difficult to wake, this is incorrect. We know that our patient is post-op. The sleepiness is typical at this time, especially in the recovery phase. So you are not supposed to be concerned this time. This is expected in the recovery phase, especially if they were just transported to your recovery room. Post-op, I should say immediate post-operative phase. Nothing to worry about this. Letter B, there is increasing swelling at the neck. Increasing swelling, that's not a good sign. This is possibly going to obstruct the patient's airway. So you should report this to the surgeon right away. This will require rapid medical intervention or surgical intervention to prevent the respiratory distress. Take note of the increasing swelling, possible obstruction in their airway. This is an airway issue. If you answered letter C, the patient rates the incision pain as 7 out of 10 in the post-operative phase. This actually is a common report by the patient post-surgery. So this is something that you can manage, not something that you should call to the medical provider or the surgeon. This is expected. What about letter D? The patient's heart rate is 112 beats per minute. That's tachycardia, right? This is also expected in a hyperthyroid patients post-surgery because they still have the remaining thyroid hormones in their circulation. But this will resolve as the thyroid hormones will decrease after the immediate post-op phase. Okay, so this is still expected. All right. So the correct answer here is letter B. And finally, we have our last item of the day. We have item number 20. A patient who had a partial thyroidectomy earlier in the day returns to the surgical unit showing signs of laryngeal stridor and hand cramps. What collaborative action should the nurse prepare for? Is it A, clear the patient's airway through suctioning? Or B, administer intravenous calcium gluconate? Or C, plan for an emergency tracheostomy? Or D, get ready for endotracheal intubation? Your patient had a partial thyroidectomy earlier in the day. Now he returned into the surgical unit, but now has laryngeal stridor. and cramps in the hand. So what you should prepare for in this situation? Will you do A, B, C, or D? Well, if you answered letter A, clear the patient's airway through suctioning. Do you think that the suctioning can address the stridor caused by the hypocalcemia? No. Take note, guys, your patient has stridor, that very noisy breath sounds that signify that there is narrowing of the airway, and this is commonly caused by the hypocalcemia, which is caused by the inadvertent removal of the parathyroid gland. Okay, so your patient now has hypocalcemia. That stridor is a sign that they have laryngeal spasm. Not a good sign. They have hypocalcemia. So your action would be geared towards preparing to administer the IV calcium gluconate, not suctioning. The suctioning will not really address the issue of hypocalcemia. If you answered letter D, get ready for endotracheal intubation. The intubation is only necessary if the calcium administration is ineffective, but this is not the first line of action. Indicated if calcium gluconate is not effective. And again, not the first line action to treat the patient's stridor. It's a possibility though, but not the first line action. If you answered letter C, plan for an emergency tracheostomy. This is also an invasive procedure, but this is also a secondary action. You should administer the calcium gluconate because this is what is going on. There is hypocalcemia causing the airway to spasm. Only indicated when the calcium gluconate is ineffective as well. So you're eliminating letter C, letter A, and letter D. We should treat the patient's hypocalcemia by administering the calcium gluconate intravenously. So that ends our drill for today. I hope that you are learning from this exercise, and I thank you for your participation, and I will see you again tomorrow for another session. Again, I'll see you. You all take care. Bye-bye.